Now, for the cranial nerves, you have a couple mnemonics here. Well, one mnemonic, there's a bunch of them in Google. You can search for it in any one of your search engines. So you have a total of how many cranial nerves? 12. By the way, this one doesn't work here, but there is a link to Quizlets if you want to go over those cranial nerves, which I recommend you do that. Okay? So the mnemonic is O is for olfactory, which is smell. Smell is what? Sensory or motor? Sensory, right? Now, the next O is what? Optic nerve. What is optic for? Vision, right? So that's number 2. Is vision sensory or motor? Sensory. When you see something, it's just pure sensory, right? You perceive the light. Now, number 3, the next third 3, which is OOO. And that is known as oculomotor. Is that sensory or motor? I mean, it says motor. So most likely going to be motor. Remember that which is the one that does not go through the thalamus? The first one, the olfaction. So after the third O, 2, which is what? Trochlear nerve. This is cranial nerve number 4. So what are the nerves that innervates your eye? I'm going to give it a different color here so you can have a difference. So you have trochlear nerve, abducent nerve, and oculomotor nerve. Can you see the difference between those 3? These are just what? These are for the eye. What do you mean eye? Well, the oculomotor is going to do what to the eye? Oculomotor, what does it move? It moves the eye, guys. This is motor. So the other one is your trochlear nerve. What is your trochlear nerve going to do? Huh? Trochlear is the one's going to move your superior oblique muscle. Okay? The abducent nerve is the one who's going to be able to do what to your eye? That's going to innervate your lateral rectus. Okay? It's going to move your eye away from the body. Okay? Now, there's optic nerve for the eye, but this eye that we're talking about here is just what? Motor. This is what? Sensory for the eye. Everybody got that? All right. Now the next ones that we're going to have are going to be, bless you, are going to be your facial nerve. So facial nerve innervates most of the muscles and nerves of your face. So facial is a mixed nerve. Your trigeminal nerve, which is they call it the dentist nerve. This is number 5. It's going to have 3 branches. So one is ophthalmic, which goes to the eye or around the eye. One is going to be maxillary, which is going to be in your maxilla, including your gums and teeth. That's why they call it dentist. And then the last one is going to be mandibular. So the lower row of teeth and the gums, right? And part of your bottom aspects of the lips, right? And the chin. So that's going to be all your trigeminal, right? So that does both, right? Trigeminal nerve also is important from your main muscle of mastication, which is your masseter. Your masseter, you should know that there's this muscle right here. So that is the most potent muscle for mastication, and that is innervated by cranial nerve number 5. This is a test question. And then you have your vestibulocochlear nerve. So we did OO2, touch, trochlear, and feel, very, and that's where we are. Vestibulocochlear nerve. The vestibulocochlear nerve is part of your ear. So inside your ear, you have a vestibule and a cochlea. So hence the name vestibulocochlear nerve. So this is only going to be sensory, and that's for, well, it says it here, right? Auditory. Then the next one we're going to have is good, which is called glossopharyngeal, which is glossal means what? Your tongue, right? So glossopharyngeal is going to be your glossus, your tongue, and your pharynx. So it's going to innervate both the tongue and the pharynx. And then we're going to have your vagus nerve. Vagus nerve is the longest nerve of them all. longest of them all. Your book calls it the wandering nerve. Why do we call it wandering? Because it goes up, down, sideways. It's the longest. So the book calls it wandering nerve. And then you have, finally, right, that was the velvet, and then which is your accessory nerve or spinal accessory nerve. Okay, this one's going to allow you to do what? Shrug your shoulders, right? Just move your shoulders up. And then last one is heaven, which is your hypoglossal. And this is actually going to be for swallowing and speech. So those are your cranial nerves. You should know them. Okay. So you have, apart from the cranial nerves, you have something known as what? Spinal nerve. What do we call it spinal nerve? I believe because they come from the what? Cervical, brachial, lumbar, and sacral plexus. We talked about those, right? So you need to know the difference between a spinal nerve, which all of them are what? All spinal nerve tends to be what? Mixed nerve. Okay? Well, the cranial nerves are found within the cranium, and they can be what? Sensory, motor, or mixed. Both. If they're mixed, both they carry sensory or motor information. And you have all the nerves right here. So here's a summary of the cranial nerves. I'm going to give you a little more information. Okay. So the first part that you see here, let me do this in green. First one you see here is olfactory bulb. So this is the bulb. This actually olfactory bulb and olfactory tract is part of the olfactory nerve. So you need to know the anatomy of the olfactory nerve, which is the bulb and the tract. Filaments of the bulb goes through a orifices, which is known as the cribriform plate. The cribriform plate is on the roof of your nasal cavity, which is on each side of your crista of Galli. Okay. Now, you have your optic nerve, but in the optic nerve you have another structure known as the optic chiasm. What does that mean? The optic chiasm is where both nerves crosses. So whatever eye you're seeing from the right side is actually being collected on the left side. Whatever is top is being collected like bottom, and whatever is bottom is up. Everything is opposite on the eyesight. Okay, your brain just flips the images all the way through. That's what we do it. Then we have another weird one is your trigeminal, and trigeminal has how many? Well, trigeminal has 1, 2, and 3. And we said that those 3 were what? B1, B2, and B3. And we call those what? Ophthalmic. What else? Maxillary and mandibular. Okay, one was for the eye. Remember I did this with fingers, right? So ophthalmic, maxillary, and mandibular. You can see that the facial nerve is mixed. Your vestibulocochlear is pure sensory. Vagus, let me see, the word is here, is the main parasympathetic mediator. So please know that is the main parasympathetic mediator and is a wandering nerve. Please remember those keywords. Okay. So vagus nerve is important for what? Swallowing. So imagine if something happens to the vagus nerve, would you be able to swallow food? No. You have to be fed the whole life, right? With tube. Or a parental way. Either a feeding tube or a parental way. So here is actually divided into which ones are sensory and which ones are what? Motor. And then as mentioned before, the cribriform plate, that is your olfactory nerve. This is your cribriform plate. A bunch of orifices around here. That's where the olfactory filaments go through. And they are the ones who are going to pick up smell, different type of smells. Okay. So you can see here better. We have olfactory nerve fibers or filaments. Olfactory nerve. It goes to the bulb, which is this one, and then it moves to the olfactory tract, which takes the information all the way into the insula. So if you look at it, you have olfactory epithelium. This is the actual row or order: olfactory fibers, olfactory nerve, olfactory bulb, olfactory tract, and temporal lobe. Inside the temporal lobe, the insula, right? We have your optic nerve, and in the optic nerve again, the nerve crosses at the level of the optic chiasm, and then you have something on the back which is called optic tracts. Like imagine a bunch of lanes, right? They call it tracts. So all those tracts radiates to these projection fibers, and each one of those projection fibers, they get their information into the occipital lobe. So those are the structures. So optic nerve, chiasm, tracts, and projection fibers. So muscles that control the external eye movement. We already did this once, right? At the beginning. So superior oblique, that you can see here. That one, this nerve right here, is called the what? The trochlear nerve, correct? That's current nerve number 4. And then you have another one which is known as is cut, is this part right here. It's called the lateral rectus. It allows for what? Abduction of the eye. And if you follow the nerve, that nerve is known as the abductor nerve. That's current nerve number 6. Please remember, if you already learned the current nerves, learn it with Roman numerals, because they will be testing you with what? With Roman numerals. Okay? So please know those. And then we also have the rest of all the other muscles of the eye, which are going to be given by your oculomotor nerve. Again, these are all the nerves that control the extraocular muscles. Okay? We have one nerve here. I'm going to do it in a different color so you understand this. That is pure sensory. They're all motor except this one right here. This fat one right here on the back. That is your what? Your optic nerve. Now it's a different color. Okay? So please know that's your optic nerve. Then we have trigeminal, which is number 5. We said that in trigeminal, you have an ophthalmic branch right here that goes to the eye. And then you have a maxillary branch. And in the maxilla, you can see that this one gives you a segment to what? To the infraorbital, right? Oh, the whole thing here about the maxilla, right? The top of it. As well as the gums inside. Now, then you have another branch which spreads out, and that is known as the mandibular branch, which again, the lower rows of teeth, the gums, the tongue, right? And the inferior aspects of the mentum. Okay? So then we have facial nerve. Facial nerve, we said that in the face, you have a lot of things. You have your muscles and you have sensory perception. So the facial nerve is a mixed nerve. So almost all superficial muscles of your face, so the muscles of facial expressions when you're sad, happy, whatever, disgust, right? All these things, they're actually innervated by cranial nerve number 7. So superficial muscles of the face. The deep muscles of the face is most likely by your what nerve? Those are the muscles of mastication, and those are by your trigeminal. Everybody got that? So superficial muscles of the face, most likely facial, right? Deep muscles of your face, which is the muscles of mastication, mainly the masseter, remember that one, is by cranial nerve number 5, which we call it trigeminal because it has how many branches? 3. So motor, again, is for facial expression muscles, and the sensory is for taste. I'm not gonna go that much in detail on taste, but taste is actually 2/3 of your tongue, the first 2/3 of the tongue. Okay. Now, let's talk about facial problems. So what are these? There's something known as Bell's palsy, and there's another thing called a stroke. And what do we have? We don't know. So what is a Bell's palsy? And what is the difference between a Bell's palsy and a stroke? So Bell's palsy is a facial nerve lesion. So that means a damage of your cranial nerve number 7. If that happens, this facial nerve lesion is on the periphery, in your soma, near your body. Not on the brain, but in your soma. So if you look at it, how many cranial nerves do you have of number 7? 1 or 2, 3, 4, 5, 15? 1? Why 1? Think about this. You only have one side of the face, or you have both sides of the face? 2 sides of the face. So there's 2 nerves for each. 2 olfactory, 2 ophthalmic, right? 2 facials, 2 of each. Okay? There's 12 pairs. Now, if it's peripheral, then this Bell's palsy, it affects both the complete half of the face, as you can see here. So the individual is about 20 to 50 years old. This will take hours to a few days, right? The upper part of the face is affected and the lower part of the face is affected. In other words, half of the face, okay? You guys ever seen this before? This is common. So people actually have a facial droop, like their corner lip like this, their eye is down, and you ask them, wrinkle your forehead, and they can't wrinkle anything because it's all droopy. Does that make sense? Because that is a peripheral lesion, facial nerve number 7. Now, on the stroke, the stroke is a damage to the blood flow into the actual brain. So this is in the brain. All right, this is actually a damage to the supranuclear lesion. Again, this is inside the brain. You see the lesion here, right? So it's not on the periphery. The brain is capable, since you have 2 hemispheres, in one hemisphere is damaged, the other one will take over, correct? So the patient who has a cerebral stroke, you can tell them, wrinkle your forehead, and they're able to wrinkle their forehead. They will have a lip drooping or nasal drooping, right? Only 1/4 of the face. So even though this is worst, this is the worst condition, right? It actually looks what? It looks better. Because they're able to do what? Wrinkle the forehead. Why so? Because you have one brain hemisphere taking over the other one. You say like, oh, why didn't it happen here? Because there was no damage. They didn't have to do anything. Does that make sense? So this is peripheral, all right? And this one is a deep lesion within the brain. Okay? So what other things can we see? Well, on the stroke, you have a slurred speech, double vision, facial numbness, difficulty swallowing, vertigo, and ataxia. So that is the difference between Bell's palsy and your stroke. Right? Stroke can come in 2 different flavors, right? It can be ischemic, hemorrhagic, or transient. That's how the main 3 ones they are. Ischemic is when you have no blood flow, and of course the cell dies. Hemorrhagic is when you have too much blood flow and you damage the whole brain. And transient is that it can actually go from can become hemorrhagic or ischemic.